Welcome to Nurse Practitioner Week. The presenter for this session is Victoria Baker, PhD, certified nurse midwife, and she has a certification in public health. An academic clinician, Dr. Baker has focused on health equity and vulnerable populations, working in agencies serving culturally diverse populations, consulting and teaching health equity, serving on academic committees to increase diversity, and presenting on incorporating issues of diversity into teaching and practice. She has taught undergrad and graduate students as an advisor, clinical instructor, course coordinator, course designer, and faculty team leader in online and face-to-face courses. Currently, she teaches Master's and Doctor of Nursing practice students at Frontier Nursing University. She has worked as a director of a university-based midwifery practice, public health consultant, certified nurse midwife, and representative of a non-governmental organization in Central America.
Welcome to National Nurse Practitioner Week. This presentation is in celebration of National Nurse Practitioner Week, and congratulations to our nation of nurse practitioners. My name is Victoria Baker. People call me Tori, and I am a public health nurse and a nurse midwife and a nurse educator. And I teach in the Doctor of Nursing Practice program at Frontier Nursing University. And that includes many nurse practitioners and also nurse midwives. I teach the course Health Policy and Advocacy. And that's what I'm going to talk about today, using social justice to teach policy and advocacy and scholarship in a DNP program. So I teach this course to DNP students who are all advanced practice nurses, advanced practice registered nurses. And we're all expert clinicians, but not all of my students are familiar with policy. In fact, most of them are not. And some of them are not even all that interested in learning about policy. So while most of them are quite interested in being advocates for patients, not all are interested in that advocacy and policy on a larger level, or social justice, which is justice for a population. And in addition, they often take this course late in the program, so they're often very wrapped up in wrapping up their DNP projects, and not so much thinking about learning something brand new. And finally, they think of themselves as clinical scholars, as using evidence, but not so much as using theory or using evidence for kind of a policy issue as opposed to a clinical issue. So, and all of these are important components in the course. So my job is to teach them something conceptually new and challenging to them. And today I'll be talking about that to all of this audience, who are not all students, but who are mostly either advanced practice registered nurses, mostly nurse practitioners, or wanting to be nurse practitioners. So I'm hoping that you'll all be very interested in hearing about what happens when somebody who's very clinically focused is in a course that is focused very much on the population, which has clinical implications, very important clinical implications, but is not about the exam room. So this presentation is about how I rope them in a word. For today, I'm going to talk a little bit about teaching social justice, a little bit about the challenges of the course and how we meet them. I teach it on my own sometimes and teach it with other people at other times, and then lessons learned. So, introductions. I've talked a little bit about myself. Typically, I present this real time, not recorded, and I ask people what they're looking for in the presentation. I can't do that today, but I will point out that I do know there are a lot of other things you could be doing besides coming to this presentation, and I know that, so I'm going to try and make it as interesting as I can. You could be flying, eating somewhere. I know you could be doing a lot of things, and I hope you're here today because you find it an interesting topic. If I were teaching this real time, as opposed to asynchronous, as we're doing with the recorded webinar, I'd be asking you, what do you get out of this presentation? What are you hoping to get out of this presentation, and trying to meet those expectations as I go along. Part 1, Teaching Social Justice. What do we know about teaching this topic? What evidence do we have? And I'm teaching it in the DNP where it's explicitly included, teaching social justice, in the DNP Essentials. The DNP Essentials are what guides us in what should go in a DNP program. And I want to teach it because it's there. But how should we be teaching it? And also because I really care about it. But how should we be teaching it? What do we know about what's the best way to teach it? So here's what I found out. 5, Healthcare Policy and Advocacy, and the course is called Health Policy and Advocacy, and these are the 7 essentials, the 7 components, the 7 competencies within that essential 5, and they're all included in the course. Not all of the essentials are a course, but this one is. This one is a course that covers this essential. And here they are. We have analysis of policy, we have leading policy development, we have influencing policymakers, educating people about policy, advocating. This is a shortened version that's longer in the actual document. Developing and evaluating policy, and advocating for social justice, equity, and ethical policies. So this is all included in the course. We have a module on policy content and analysis. We have a module on advocacy and persuasion of policymakers, and we have a module on social justice. How to teach it. There was a very interesting review of the literature, and I didn't look too much before that review. It's in the textbook that we use in the course. I have a picture of the textbook here. It's a great textbook. It's a very challenging textbook, but that's one of the reasons I really like it. And one of the chapters was a review of the literature on teaching social justice, because it's a textbook on social justice, and there's a whole, there's 4 parts to it, and one of them is on teaching. So they gave 17 examples of ways people teach, not on evidence of what works, but ways people teach. And these are some of the examples that they gave. Reflection and journaling, seminars, service learning, public health clinical experiences, and specifically anti-racist content. And they did a very nice job summarizing what's out there, what people have published about how they teach. Studies, has anybody looked at whether these things work? And what would tell us that these things work? How would you know? I mean, for me, in education research, I'm always disappointed, because what I really want to know is, does what I teach actually make a difference when somebody's out practicing? And I very rarely know that. Not on social justice, not when I teach health promotion, which is another class I teach, not back when I used to teach public health or obstetrics to undergraduates. I never really knew whether what I taught actually improved health outcomes and the people that my students cared for when they were out practicing as nurses or nurse midwives or nurse practitioners. That's what I really want to know. And if you think about it, that would be really hard to study. But that's what I'd really like to know. There's virtually nothing out there for that. The next best thing would be, do they pass boards? And there are a few things out for that, but not very much. In this review of the literature, there were 2 studies, and they were both based on self-reports. What do people think after they had classes that were designed to improve their knowledge or practice in terms of social justice? So 2 of them were self-reports that said reflections were useful and service learning increased their interest. So, take that for what it's worth. It's the best we had. 2000 review, there were several articles that made recommendations that it should be integrated throughout the curriculum, that faculty training was lacking, and that in one article was academic freedom was a concern, that when you teach about social justice. I've not found that to be the case, but maybe I've been fortunate. To see what else I could find from after that review of the literature, I found very little, basically. There's not very much written about it. I didn't find a lot of guidance, and you'll see in the rest of this presentation that it's kind of based on the world according to Tori, because I don't have a lot of guidance here. So Gerke, who writes really more about ethics than social justice specifically, but mentioned social justice and mentioned civic engagement, which I took as similar. She said civic engagement is foundational and that service learning helps. I went to a presentation, I went to a conference recently. I didn't get to go to the presentation because it conflicted with the presentation I was giving, so I didn't get to go. But these authors gave a presentation and have also published a study that simulation can be used, a poverty simulation with undergrads, and that had some influence on how, self-report again, on how people felt about poverty, students. The social determinants of health is really important to teach, according to the Institute of Medicine. They came out with a report in 2016, and we do use that to teach in our courses at Frontier. And the Robert Woods Johnson has had a clinical scholars program that they have used for many years to teach physicians, nurses, and other providers about about social justice, although they really talk more about community work of clinicians more than social justice. But I define social justice as the justice of populations, of programs, of governments, of groups, of policies. So when you're looking at the ethics at that level, that's justice at that level, that's social justice. So I see that Clinical Scholars Program as addressing that. And those were the things I could find when I looked beyond that review that was so well done from 2014. Okay, I got ahead of my notes. As I said, there's not a lot to the course. I'm going to talk about the challenges and talk about how we meet them. As I mentioned, students are clinical experts. I get people who are already advanced practice registered nurses. They are nurse practitioners and nurse midwives. And often they are people who find policy and population approaches opaque and difficult. They're used to the exam room. It's annoying sometimes to them to find that it's not as easy as they hoped because they worked hard to become clinical experts, and they don't like this feeling of kind of going back to being a novice. Who does? It's not like clinical care, and they thought it would be enough similar to clinical care, many of them did, that it would be easier. So that's the first challenge, is that they're annoyed that it's not as easy as they hoped. And particularly when it comes, many of them are taking this towards the end of the program, and they're busy with their projects, and they want this to be easier than it is. Is that many of my students find ethics, policy, social justice as irrelevant to the practice that they love. They love working with individuals. Now, not all of them. Many of them do the DNP because they really do want to expand into more of a population approach. But not all of them. Some of them just want to become really good at individual practice. They want to become really good at managing a practice on a more local level. And they want to be clinical scholars, but they see a clinical scholar as just learning about how to be have really good evidence-based practice. They want to lead on a more local level, many of them. So I teach it with theory, which many nurses find they don't like to know about these underlying frameworks. They often don't. They are interested in the ethics of provider-patient relationships, but not so much in the larger view often of social justice, the ethics of politics, of governments, of organizations, or professions. These are sweeping statements. This is not true of every student or every nurse practitioner or even every nurse, but it is a challenge that I often face. Some students are really excited about this, but I do have a large group that find this as irrelevant to their practice. And one of my challenges is to show them that it isn't irrelevant to our practice. It's very relevant to our practice. And often the things that we find most frustrating when we're working with an individual are the things that are outside of our individual practice, like scope of practice, or what research has been funded and what hasn't been funded and what we don't have when we need it, things that are policy related. This is an intellectually challenging course. The topics and the process of policy are intellectually challenged. It's a good challenge. It's something that stretches you. But students don't always see it that way. I present this as a graduate seminar, as something that we need to talk, discuss, work through as scholars. But I'm not going to get up there as I am today because it's recorded and just talk. I ask students to come in ready to talk themselves, and I frequently throw things out to all of them. We have live webinars, and for those who can't come live and watch the recording, I say, but you need to be talking to the recording. When I ask questions and the class answers, you need to answer too, even if you're watching it later. I see it as a graduate seminar in that way. But clinical scholar doesn't always mean intellectual to all of my students. Some of them see this as exciting, as an intellectual challenge, but others see this as a bait and switch. This is not what I expected. So I'm going to go over some of the ways I meet these challenges. And that's really the title, how I use social justice as a way to get at policy and a way of getting at being a clinical scholar. And population ethics, I use this as a professional obligation. This image is one that I use in the course. I like superhero movies, so of course I went for this. But this superhero, I mean, she doesn't look like Iron Man. She doesn't look like Wonder Woman even. She looks pretty every day. She could be anybody, even though she's a superhero. And I think of that like us. We are everyday people as nurses, but to our patients, we are superheroes. And I present social justice as the branch of ethics for policy, for population health, for something that we need to know about as a professional obligation, because to our patients, we're superheroes and they're counting on us. And I use this picture and I say, this is who we are to our patients. She shows up in the advocacy module and in the advocacy assignment. She's a recurring image during that whole module. I present that advocacy is an ethical obligation that is a stated goal of our profession, that we will use our skills and the public trust that we have on behalf of our profession and on behalf of our patients. It's a social justice is an obligation. We in our social our policy statements as the ANA as a profession, we have said that we will advance population health via policy and advocacy, and we'll advance social justice in that way. And I even quote Spider-Man's uncle, quoting, I cite Wikipedia, who said that with great power comes great responsibility. And we do have great power because we're highly educated. We have some very specific knowledge, very esoteric knowledge that the public doesn't always have. And people trust us, and that gives us power. We're consistently rated as one of the most trusted professions, usually the most trusted profession year after year in polls. I have an alumna that comes and speaks. I'll show you a picture of her later. She is a family nurse practitioner from Indiana, and she is passionate about how the DNP prepared her to speak on behalf of her patients because of the trust that she has and the skills that she has, that she feels an obligation to use those skills. So that's one way I use to talk to my students about the importance of social justice and of policy, and that it's a professional obligation that we have. Another method that I use to get at policy is that we build on previous coursework, and the modules build on one another. So I capitalize on the program training that we have in our program. They have to first take the evidence-based practice course. They have to take the epidemiology and statistics course. They don't need the statistics, but they need the epi, and the leadership course. And those courses are very much a part of the DNP, much as this is. And its advanced nursing practice includes any form of nursing intervention that influences care outcomes for individuals or population. That comes from the American Association of Nurse Practitioners. So we urge students to use this course to increase their skills in these arenas. We build on the evidence-based practice course to be able to find evidence that supports policies. We build on the EPI course because you use epidemiology to show the importance of a problem when you're talking to a policymaker. And leadership, because you have to be able to talk to policymakers in order to advocate for policies. So we have assignments that use those skills, and we build on those skills from the previous courses. We also, I pretty much insist that people, when they do their assignments, choose policies that are related to their DNP project clinical interest. If they're earlier in the program and they don't have a project yet, I tell them to use the clinical area of interest that they plan to do their project in, because I want them to understand how policy is related to their clinical area of interest. So we build on that as well. And the modules work step by step. So the modules build on one another as well. So those methods are ways that I try and make policy less opaque to them. They have an assignment that's a health policy analysis, and that's individual. And then they go into teams, and they use one of those teammates' policies to do a policy packet where they put together a packet of a letter, a fact sheet, and a presentation where they would try to persuade a policymaker towards that policy. And finally, they have a social justice analysis that also works on usually the same policy, and as a team again, and they use one of the teammates' policies. Another way that I try to address these challenges is that I really try to build on the clinical scholar concept and an intellectual maturity. So we use a seminar format, and we use team discussions to master difficult concepts. These are difficult concepts for people who are focused on individual care. We use the social justice textbook that I mentioned before by Kagan, Smith, and Chin, and it introduces advanced scholarship. It's not a simple read. If you're used to reading clinical reports, and those weren't easy at first, but now they are to our students because they've been reading them for a long time. These are different. These are theoretical chapters. And they're hard. You have to read them a couple times to really get them. But I assign them, I ask the students to divide them up and each pick a couple chapters and come back into their teams and think about which chapters will support their assignments the best and talk about them and discuss them together. And we discuss them in the webinars as well. I want them to think hard about these concepts. I want them to have I want them to develop their intellectual capacity. I want them to be clinical scholars. They apply these to clinical problems at a policy level. So that's what we work on. 2 of the assignments are team assignments, and that's on purpose so they can talk about it together, and we talk about it in the webinars. And they get extra credit for recording their team process. And again, this is to encourage discussion of the concepts. If you talk about more than logistics, if you discuss the concepts together and record it, you get extra points. Finally, I draw on frontier nursing history as a way to really bring people in. We have a lot of students who know our history and come to us because of it. And so I use an image that is a ubiquitous one all over the place at Frontier, the banyan tree. And she talks about the banyan tree spreading out its roots. So, and that nourishes the tree, that it has many roots, many trunks, and these, and also, in addition to the evidence-based policies, it's also our credibility as nurses, that there's many things in those trunks, and that you get excellent and equitable clinical outcomes as the many branches and leaves from those trunks. So I use that drawing. It's right at the beginning of the course. Mary Breckenridge said that, she went out with a mission to serve rural Kentucky. She was trained as a nurse-midwife and as a public health nurse, but she knew she couldn't do it on her own, even though she had the clinical skills. So she went out with policy. She managed to create a system of clinics and clinicians that went out on horseback and gave care across across rural Kentucky, across two counties of southeastern rural Kentucky. And she wrote in the book, "We have grown like the banyan tree, with branches yielding shade and fruit to wide neighborhoods," 1955. So we use this history to bring our clinically focused students to think more broadly about care. If she hadn't created that system using policy methods and thinking about it in a broad way in terms of populations and social justice, she never would have been able to use her clinical skills. So we present that, and we present it as an ethical imperative, just as Mary Breckinridge did. So I capitalize on that. So here's where I would ask everybody what they've learned in their teaching or their experience. And I can't do that on a recording, but I can tell you what I've learned so far and what I've learned when I presented this information from other people. Things that I've learned from it. Methods. The methods I've used, I think, have definitely challenged students. Now, of course, people have to rise to the challenge, and some of them love it and some of them hate it. I do see some really rise to the challenge, do new kinds of things that they've never done before, and in the evaluations you can see that they were excited about it. Others are not so excited. They just do the minimum and move on. But I do see them doing high-level work where they can distinguish a policy problem from a social injustice, because not all policy problems are social injustice. I can see them using frameworks to explain why a policy solution should work, so they can explain that to a policymaker. This is why this policy solution would work. This is why this theory supports it. I can see them distinguishing which kinds of evidence would work to explain why a clinical solution works, and other kinds of evidence that would explain why a policy solution would work. And I can see them admitting when evidence is inadequate to support their policy and still arguing whether it should or should not be adopted. So I've seen them actually do some pretty high-level stuff. It's pretty exciting. And I'm not sure what we still need. I would really love to see more research in this area, but like I said, the kind of research I'd really like to see is pretty hard to get. Promised you, this is Dr. Judy Stig, FNP, Indiana. That's her at the Indiana State House. Is she the real measure of success? Do I have a lot of alums going out like that? Judy and I just happen to hit it off and are still in touch. And she writes me, and she comes back to the class, and she talks to students about what she got from the class and what she got from the program. And she talks about what she's been doing. We have a short video in the course of her testifying on a food program in Indiana. She was great. She had like 60 seconds, and she used it wisely. She didn't go over the program again because she knew that her audience, which were policymakers, legislators, already knew what was in the program, and she knew where their constituents were. So she talked about her patients and that they were in their districts and what her patients said to her, and that's how she used her time to convince these policymakers. It was really good. So I think she's maybe the real measure of success. I hope there are many of her out there, but I don't really know. Maybe that's the kind of evidence that the studies that we should have, is to go back and see how many of our DNP graduates are doing this sort of work, and what did they attribute it to? Would they have done it anyway, or did this kind of course make a difference for them? Here are my references, selected references, things that I thought might be of use to you. This includes the textbook I mentioned, Philosophies and Practices of Emancipatory Nursing, Social Justice as Practice. It's a great book. And you can pause this and grab what you need off of it. And here's how to reach me. I hope that you feel free to send me comments or questions, and have a great nurse practitioner week. Thanks for listening.